I do some show would be of interest to a few people, particular segments of people and particular organizations and entities. But every now and then, I do a show that affects and impacts and has the potential effect of impacting everybody. Well, everybody who's under the sound of my voice and who I'm in their vision, I want you to pay particular attention to this show because we are going to discuss a phenomenon that's absolutely amazing to me. As a matter of fact, the reason I'm doing this show virtually with Dr. Patrice Walker of Navicent, and we'll meet her in just a minute, is because this phenomenon has put restrictions, on all of us as it relates to getting out and going to sports and socializing and going to restaurants and things of that nature. And we tend to wonder, well, is this really serious? There are people calling it fake and, saying it's a political ploy and things of that nature. So it's very important that we learn about COVID-19. Equally as important is for us to have somebody who's going to educate us and explain it to us and make suggestions to us and warn us and do all of the kind of things where we can get through this. And I know this is a long introduction, but since it's my show, I'm going to talk for another minute. So what we want to do, the purpose of this show, Dr. Walker, is to impart as much information as possible to the community because, there's an uptick, in cases as it relates to the coronavirus and how it's affecting everybody out with physically, socially, academically, spiritually, economically, and every other kind of lay that you can imagine. So this is a call to action.
A call to action.
I'm your host, Alex Habersham, and as I said, I'm more than a little honored to have Dr. Patrice Walker. And just tell us a little bit about yourself, Dr. Walker. You got such an interesting story.
Well, thank you. And thank you for having me, Mr. Habersham. It's always a pleasure to be with you on a call to action. I'm a local girl. I was born and raised in Monroe County and graduated from Mary Persons High School, went to college at Georgia Tech, came back to Mercer and attended medical school at Mercer University School of Medicine. And then I did my residency in obstetrics and gynecology at the Medical Center in Navicent Health. I then was in private practice for several years, and then I came back and began teaching in the OBGYN residency program. And from there, I transitioned over into hospital administration, which is what I do now. I'm the chief medical officer at Navicent Health.
Now, I hope y'all heard that she's the chief medical officer, and I want to congratulate you for that esteemed position. And, I know that you are doing a phenomenal job. Well, let's get right into it. Let's talk a little bit about COVID-19. And you can kind of give an overview if you wish. I've got some specific questions. You can mention the uptick. You can mention some of the preventative things that we can do. And you can also emphasize, that it's real. I mean, you can, from whatever perspective you wish, you can talk about specific cases. I know that you've seen them. And one thing I want you to discuss, and I know this is a lot, I'm sorry, we'll keep it flowing though. Uh, talk about we talk about what happens, since I got this gray hair, I want you to talk about what happens to seniors. Sometimes it's overlooked the potential effect that it can have on seniors. We got young people who, we'll talk about that, the difference between young people and seniors as it relates to COVID.
Sure, certainly. So I hope by now that there are not people here listening that think this is a joke.
Hmm.
If there are, I mean, I feel sorry for you because it is not a joke. We are in a global pandemic, and that means that there's nowhere on this earth that you can go to get away from COVID-19. It's everywhere. So I just want to start off and make that clear. As far as who it affects, it affects everyone. It can affect children all the way up to the elderly. And to your point, it seems to affect the elderly more. We know that it affects people who are older, but it also affects people who have poorly controlled or maybe undiagnosed medical problems like diabetes, high blood pressure or heart failure, you know, um, chronic renal disease or chronic lung disease. If you have any of those, then your risk of having a severe version of the disease is increased. We
Wow.
also want to talk about the disparities that we're seeing out there in the African American community. I really want to stress that. And what the virus itself is not different between white and black people. Unfortunately, we have a baseline of disparity, health disparity in the African American community. So at baseline, we are less healthy than some of our other counterparts. And thus, when and if we get exposed to COVID, we are more likely to have that severe disease because we are undiagnosed or underdiagnosed or undertreated with many of the chronic diseases that I already mentioned. And so the African American community really needs to be more aware and more vigilant because it is unfortunate, but it is true that we are at more risk of dying, more risk of having a severe disease than our counterparts.
And then I think some of that is attributable to the fact that we don't have insurance, we don't go to the doctor, we overlook symptoms, we think it's not going to happen to us. And, for individuals, particularly individuals who say don't have access to healthcare, and a lot of people don't realize that. A lot of the national leaders don't really understand, well, why, yeah, or either they don't understand or they don't care. Why is it affecting minorities, particularly African Americans, disproportionately? So, what are some of the things, what are some of the resources that are available? We could talk about the resources that are available at Navicent because, you just told everybody to take it seriously. Well, then a lot of the people, as don't have access to, they think they don't anyway, because there are some entities, there are some programs or what have you that are available for people who don't necessarily have, insurance. So talk about those resources that are available, and as in addition to education, what are some of the resources that are available?
Absolutely. Um, right now, if you have access to the internet and you go to the Navicent Health homepage, there is a consumer toolkit there that lists all the various resources that we have made available for free to our community. And I can't list them all, but I can certainly bring attention to, we have a symptom checker on there. So if you don't know, if you're having symptoms and you're not exactly sure, is this COVID? What do I need to, how concerned do I need to be? You can put your symptoms in this, and there's an algorithm, and it will help you determine how concerned you should be, if you should be contacting, your physician or coming to the ER. So that's first and foremost. We also have a virtual care product out there that you can have a virtual visit, a screening visit, again, for free, that you have access to a healthcare provider that can do a basic screen for you and determine whether or not you need to come in and be seen in person. And even after, let's say you've gone through the process and you are discharged home from the hospital, but you don't have a primary care provider, again, we have some virtual resources that can follow up with you to make sure that your recovery is going well. So we have you from the beginning till after the end, and these resources are for the community. We want everybody to have access to care. We don't turn anyone away. And so we want everyone to know and understand that Navicent is here for our community.
That is absolutely phenomenal. This is a call to action.
A call to action.
I'm your host, Alex Habersham, interviewing Dr. Patrice Walker, the Chief Medical Officer for Navicent Health, and we are talking about COVID, its effect, and preventative processes that we may engage in. How about locally? I mean, I know, talk about the effect locally, and also talk about certain behaviors that seem to be evident across the country. And I don't know how much it's affecting Central Georgia. I know that there are cases, and I know that Georgia is a state that's in red when they show that map of over 50,000 cases. And I don't know whether we had an uptick yesterday in Georgia, but it's my understanding that statistically, it is documentably on the increase. So talk about locally and talk about some of the behaviors that are prevalent and that's causing this uptick. I don't know whether I know that we open soon, and I know there were a significant number of cases even yesterday. So talk about those cases and talk about what's going on with it locally. And while you're at it, I know I'm giving you a lot, but while you're at it, talk about the structure that I'm seeing built up the street from me. That's supposed to
Absolutely.
be connected to having uh, the facilities to provide more care in case that it's needed.
Sure, I'll be glad to. So, for your first question, as far as locally, and I can say locally and for the state overall, yes, our numbers are increasing.
Wow.
However, I will say we are seeing younger people are the cases that we're seeing now. Initially, we were seeing more elderly cases, the more traditional cases. So we're still seeing those, but the newer trend that we're seeing is more young people getting the disease. Now, that's both good and bad because we do know that more younger people will have a milder version of the disease. And so less people may necessarily need to be hospitalized. However, a milder version of the disease means you don't feel so bad, you don't think you're so sick, so you're more likely to go out and about, running errands, doing this, that, or the other, and come into contact with people and then continue to spread and spread. So that's what we're seeing locally here in the Middle Georgia area as well as the state.
Let me interrupt you quickly. Although you may have it and you don't feel as sick, but in most instances, all of these young people got parents and grandparents and aunties and church members and people that they come in contact in the community. Is it possible for that young person who doesn't feel so sick initially because they're young and got strong lungs and things of that nature and don't have any of these diseases, can they give it to somebody?
They absolutely can. And that's what we're trying to prevent. We're trying to prevent that spread from the asymptomatic or mildly symptomatic person to other people that will not be able to have or that will have a more severe disease. And so that's why it's so important for everyone to wear a mask. Let's talk about that for a few minutes.
Yes, ma'am.
everyone, whether you think you've had it, whether you've been exposed to someone, if you feel fine, if you don't feel fine, everyone should be wearing a mask when they go out into the world. I don't expect anyone to sit in their home and wear a mask. And if you are able to at work, if you have an office at work where you can close your door, you don't have to wear a mask there either. But if you're going out to run errands or go to the grocery store or, live life, then you need to have a mask on. The mask is what we protect each other with the mask. So, because you can't tell by looking at someone whether they have it or have had it or what. So you wearing your mask protects everybody else from you, and everybody else wearing their mask protects them from you. So it is a mutual thing that needs to happen. Not just wearing a mask, but we also need to keep in mind proper hand hygiene, and that means washing your hands with soap and water frequently for 20 seconds, or using an alcohol-based hand sanitizer often. I try to do that every time I change venues. If I go out somewhere, I'm putting the hand sanitizer on. When I come back in, I'm doing the hand sanitizer. Of course, washing hands in between. When I come home at the end of the day, I'm washing my hands. So we just need to make that part of our routine. And when I say mask, I do want to be clear. Everybody may not have a hospital type mask. That is fine. Any kind of face covering is better than nothing at all. So you could have a scarf, you could have a bandana, anything that covers both the nose and the mouth. I cannot tell you how many times I've seen people with the mask pulled down under their chin or over their lips, but under their nose. And that's no help. It needs to cover both the mouth and the nose to be effective. But it doesn't have to be a hospital mask. It can be any kind of covering that's better than nothing. And if you don't have a covering, even if you do have a covering, you still want to put that 6 feet of space between you and the next person, if at all possible. So if you're standing in line somewhere or what have you, you want to try to distance yourself. And most businesses out in the community have done a good job of trying to have markings on the ground to help us maintain that distance. But we need to pay attention to those markings and really abide by
Now, one thing that I think is important, and you can talk to this, but like if I've got somebody living in my house who's still partying and not really paying attention, don't have a mask, still going to the club, still going to events with a lot of people, then don't you think that maybe these seniors and these people who are more susceptible to catching the disease, who in fact have young people living with them who are not showing the precautions, don't you think it's incumbent upon us as seniors to address it? Make them wear a mask or tell them to find somewhere to live, because last time I checked, when you got these symptoms and these diseases, this thing is pretty serious and could be pretty final.
Absolutely. I mean, you certainly need to have that discussion with your loved ones, with your family, and let them know what the deal is in around me in my household. And if you're able to isolate yourself or have them isolate themselves, however you can work it out, then you want to try and do that. They stay to their room, you stay to your room. Try to do it however you can do it. People have different living situations, so you're at the mercy of that. But to the extent that you can go in your room and close the door, and they can go in their room and close the door, you may try to minimize the shared space that you have to have with that person. I would absolutely say that at a minimum. And again, even within your own home, frequent hand washing, hand sanitizer in your home. If you have to share it with someone that's going in and out, then those same basic rules still apply.
Now, talk a little bit about, how contagious this disease is. I think sometimes, yeah, is it correct that it's highly contagious, and you can catch it from spreading in the air, or somebody could sneeze, and if you're within range of that, whatever the mist that's being spread, then you can catch it from that. And then,
Right.
there have been some controversy, I don't know how true it is, about surfaces. I don't know whether how true that is, but some people saying you can't catch it from surfaces and that it only lives 8 minutes. But talk about just being extraordinarily precautious.
Right. So no, it is very contagious. That's why. So the 6 feet rule is there's science behind that 6 feet rule, because we know that from a cough or a sneeze, there is a distance and there is an amount of time that is important. In healthcare, we say that amount of time is about 10 minutes. So if you're going to spend at least 10 minutes within 6 feet of someone who either has it or potentially has it, then that's long enough and that's close enough for that virus to get to you. So that gives you an idea of the extent of how easily it spreads. And yes, it can live on objects, but it lives based off of, there has to be enough of the virus on the object for you to catch. I can't necessarily quantify that, but that has to do with, how heavy of a load of virus there is. So we want to avoid touching our face, our mouth, our nose, and touching very common items that a lot of people touch, like door handles and doorknobs and that sort of thing, that are very common. You want to try to avoid touching those things if you can. Touch it, with a paper towel and throw the towel away, or grab it with your shirt, or anything that avoids touching it with your fingertips. If you can bump something with your arm or your elbow, your fingertips are going to be, you want to avoid that, because we do touch our faces a lot more than we think we do. So we just want to avoid doing anything that's going to bring us into contact with a high viral load that we would then put towards our face or our mouth.
Okay, how about locally? I mean, how are we doing? And, and just trying to examine uh, the death rate. And I know that Navicent is taking patients from other, I think I know, I mean, I'm not an official, but just be, I'm not Dr. Alex, but based on what I've heard, that sometimes, being helpful, that we might have patients because of Navicent's ability, frankly, to take care of people, and because it's a world-class institution. So how are we doing locally?
Locally, I can just tell you in general, we're doing okay. You are correct in that we do accept patients from, far and wide. We are the referral hospital, and so we get patients that are not necessarily, they don't live here in Macon Bibb, but they come from elsewhere. If they're in a community that doesn't have a hospital, or their hospital can't take care of the severity of disease. And so I did want to mention, you mentioned the building, the structure that we have received from the state. So the state of Georgia provided us with a temporary medical unit that is, I mean, you go inside of it and it looks like you're in a hospital, because you are. But it has 22 additional rooms that we can utilize. So it has increased our capacity and our ability to help take care of those patients. Because don't forget, while there are plenty of COVID patients, we also have plenty of patients that still need to get their normal care. We still have people having heart attacks and strokes and car accidents. So we've got to have capacity for them, but we are also confident that we have capacity to take care of any patient that has COVID as well. So we have capacity inside the hospital, and we have capacity outside of the hospital in that temporary medical unit.
Talk a little bit about testing and the importance or lack thereof of getting tested. And I think that individuals, particularly if people are in a scenario or a circumstance or a situation wherein they think that they may have been subjected to it, talk about the importance and the availability of testing.
Mm-hmm. So testing is very important, and locally, our ability to test is increasing, and it is night and day from when it first started. When it first started, we didn't have any ability to test locally. We had to send everything out up to Atlanta or out of the state even, and now we have the ability to test right here at Navicent in Macon, and we have a fairly quick turnaround to get those test results back. So I want to stress that the people getting tested now should be symptomatic and or if they're not symptomatic, they should have been exposed to someone who has COVID. So somebody told them and called them and said, hey, I've got it. You need to get tested, whether or not they have symptoms. The first thing I would recommend is if you have a doctor, call your doctor's office to see if they have a preferred, some doctor's offices may have testing available. If not, then the next best thing is to call the health department. The Department of Public Health, that's what the local health departments are here for. They have testing availability on site as well, but you should not just show up. You should call first because there's a process to get tested, but that testing is free, no charge for that testing. But also, where you go to get tested should be based off of your symptoms. If you're ill and feeling bad, then you should go to the emergency room or one of the urgent care centers, and they have the ability to test you from there too. So make sure you know if you're symptomatic versus asymptomatic. We also, again, going back to Navicent's website, you can put your symptoms in and it'll direct you to testing locations as well.
Okay, use this final minute to kind of encourage people, to be safe, to wear masks and talk about, how real the disease is and how possible it is if you don't follow the guidelines, it is to catch it.
Absolutely. The disease is real. It is very possible to catch it, to spread it to others who may not be able to fight it off. I cannot stress enough the importance of wearing a mask, hand hygiene, and staying 6 feet apart from others if you can. Now, I understand we're all tired of being at home. I'm tired of being at home. I got an 8-year-old tired of being around me, so we are going to have to live our lives. We have to work. We have to do those things. But there is a way to do it to minimize the risk. The risk is never going to go away, but you can certainly minimize the risk if you just do those basic, simple things of wearing a face covering or mask, performing hand hygiene, and trying to distance yourself from others when you're in an area with a lot of people.
I'm going to encourage everybody to share this very, very crucial information with everybody people you love, people and your friends and associates and colleagues. I also want to publicly thank Dr. Walker for this very, very important information. I want to reemphasize that if you go to Navicent's website, there are several. And then she emphasized free. I was going to ask her if these resources were free, but she mentioned that they are free. So, there are no excuses. If you need some help, or if you want some information, if you want to educate yourself, then there are resources available for you to do that. I'm so appreciative, Dr. Walker, for you providing us this information. This is a call to action.
A call to action.
I'm your host, Alex Habersham, having interviewed Dr. Patrice Walker, the Chief Medical Officer of Medical Center Navicent Health. Thank you so much and have a great day.